Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning, and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin, and I'm so proud to be here with my son, Dr. Jared Shatkin. Jared, you've been working with me now over a year.
Yeah, about almost a year.
Almost a year.
Yeah.
Well, you did your residency here for a year before that.
True.
And it's been just a really amazing experience. You know, I got to work with my father for over 20 years before he passed away, and I'm hoping to have the same experience with 20 years with you. It's been fantastic. You've been doing a ton of mini implants.
Oh, yeah. Yeah, about 1,000 so far.
1,000 implants in less than a year?
Yeah, probably.
That's more than the majority of dentists in this country have done in their lifetime, in their practice.
Well, there we go. I'm getting some really good experience here at the Aesthetic Associates Center, learning from the best, and every day is just kind of a new experience.
Lots of roundhouses and fix-on-sixes and single teeth and everything else in between. Denture stabilizations?
Yeah, absolutely. You can really pick this stuff up fast if you kind of just go for it.
Well, you know, it's also been great working hand in hand with you on the case planning. I know you've been doing a lot of the case planning for the doctors all over the country, and it's been really great because you're relieving some of my responsibility because it takes a lot of time, as you know. But you're here every morning at 6:30 in the morning doing case planning for the doctors all over the country. And what we want to talk about today, Jared, is the importance of the use of a cone beam CT.
Yeah, absolutely. I think when you're using a 2D or Panorex X-ray, you're missing a lot of material you could use and a lot of bone that you could try to find. So in my opinion, the standard of care is almost to use a CBCT for implant placement.
Yeah, I agree with that. I've been saying that for years, and it still surprises me when we give our courses like we had last week, which was phenomenal. We had over 80 doctors here in Buffalo, and it was just amazing. Dentists from California, from all over the place, and it was just phenomenal having them here from the Caribbean, from overseas. But when I always ask, how many of you don't have a cone beam? And we always get 5, 6, 7 people raise their hands that are still using 2D panoramic x-rays. And I think it's really, really important for them to realize that they are taking a chance by not having a cone beam. It's very important for treatment planning purposes to have a cone beam CT, because when we do the cases, we take the cone beam, we merge it with the model, the scanned model, and then we can actually virtually plan those implant placements, right, every day.
Yeah, and in your own practice, if you have a cone beam, you're able to double check your work, and you're able to realize when you're making a mistake, and that's what's most important, is being able to troubleshoot that right on the spot. I think with a Panorex, you're not really seeing that buccolingual placement of an implant, and sometimes you can get in trouble that way.
Yeah, buccolingual, your vertical placement, your depth to the nerve and the sinus cavity and all of those things. Listen, for decades we did it without it, and it was okay because that's all we had. Mm-hmm. But now we have the ability to have a cone beam in your office at a very reasonable price. The prices have gone down dramatically. The Generate Papaya 3D scan, the CT scan that I use in my practice, I have 2 of them here, and we use them for the residency and also for the private practice. They're down to $55,000. You also have that tax savings plan where you can use the $179 tax deduction and completely write off that unit. Of course, check with your accountant, but it's a great option to get a cone beam in your office at a reasonable price. So we're doing something really special to help you further to decide to get a cone beam in your office if you don't have one. What I'm going to do is I'm going to give you 3 months of free surgical guide stents. Those are 3D CT guided stents planned by myself and Dr. Jared Shatkin. 3 months, as many as you can do. You can do hundreds of implants with them. I don't care how many, but for 3 months, you're going to get free surgical guide stents if you buy a cone beam CT. And I'm going to do one more thing. I'm going to invite you to Buffalo, you and another guest from your practice, whether it's a staff member or another associate, to come shadow me for 2 full days. And in those 2 days, not only will you see a ton of implant surgery, but you're going to get trained on how to read the cone beam and plan the cases so that you can have peace of mind that you're doing everything ethically and legally possible to protect yourself, your patients and your practice. Come visit me, get yourself a cone beam if you don't have one, and Fitz will help you finance it at a very reasonable cost. You'll hardly even know you're paying for it. I look forward to seeing you on the next Monday Morning Minute. And also, we have an upcoming course here, April 12th and 13th. I want to see you here. So come to Buffalo, join us for our course, April 12th and 13th. And if you have any questions about cases, call me or call Dr. Jared Shatkin, and we'll be happy to go over your cases with you one-on-one. See you next time on the Monday Morning Minute.